so we're going to go ahead and perform the oral medication assessment. And so first what we're going to do is we're going to gather our supplies. So we've got our water, cups for medications, and gloves. And then we're going to check for the doctor's orders and look at the medications on the MAR and compare those to the doctor's medications and see if they're correct. And then we're going to check these medications and compare them to the MAR to see if it's the correct medication. Alright, so we've got ciprofloxacin, 1 tablet, 500 mg, and the time it's given twice a day and it's given orally. And ciprofloxacin is used for bacterial infections, and the side effects of this medication are nausea, diarrhea, headache, lightheadedness, and it is contraindicated in diabetics. And according to our chart, our patient is not a diabetic. And then we've got guaifenesin syrup, and what we have is 100 mg per 5 mLs, but according to the orders we need to give 200 mg. So what we're going to do is double it, so it would be 10 mLs, and we're giving this every 6 hours orally to our patient. And this syrup is used for cough and congestion, and it is the adverse effects of this are allergic reactions such as swelling and rashes and itchiness, and we would also not give this in a diabetic, and according to our chart our patient is not a diabetic. And then the next one is nifedipine. Nifedipine, we're giving 1 tablet, 60 mg, 1 capsule in the morning orally, and this medication is used for controlling blood pressure, and the adverse effects of this are headache, dizziness, nausea, flushing, lightheadedness, and we would not give this medication if our patient is having cardiac distress or having a myocardial infarction or something. And according to our chart, our patient is not having that. And then we've got omeprazole right here, and we're going to give 1 capsule, 40 mg, and we're doing this twice a day, PO. And omeprazole is used for acid reflux, and the adverse effects of this are headache and abdominal pain. And we would not give this to our patient if our patient was having diarrhea or something due to C. diff. And according to our chart, our patient does not have that. And then last we have hydrocodone here, and we are giving 1 tablet, 5 mg, and it's ordered as needed for pain, and the route is oral. And this is used for extreme pain, and the adverse effects of this medication are constipation, nausea, headache, vomiting. And we would not give this to our patient if our patient was under any respiratory depression. And according to our chart, we do not have any respiratory depression. And we're going to check the chart to see if our patient has any allergies, and she does not have any allergies. And then I'm going to wash my hands and put on my gloves, and I'm going to go ahead and go to my patient, and I'm going to check my medication against with the MAR one more time, the doses and the route and the time and everything. And so this is my 3rd time checking the medication before I give this to my patient. And so I'm going to take my medication out. So we've got the ciprofloxacin. We're going to take out 1 tablet and put it in the cup. And then we got nifedipine. Omeprazole. And hydrocodone. And then we've got our cough syrup, and we're gonna take out 10 mLs of this. And then we're going to there. All right, we've got our medication here. And then I'm going to ask the patient their name and date of birth. And I'm going to confirm the name and date of birth with the patient identifier wristband. And then I'm also gonna check that with my MAR to make sure that the patient's name and date of birth is correct. I'm going to have my patient sit up in an upright position, and I'm gonna ask the patient if they have any allergies, and they don't. And I'm gonna ask them how do they prefer to take their pills. Would you like them one at a time in a cup? And the patient wants them all at once. And then we're gonna explain the purpose of all our medications. So we got ciprofloxacin for our infection. We've got the syrup for cough and congestion. We got a nifedipine for blood pressure. We got the omeprazole for the acid reflux. And we have hydrocodone for your pain. Is there any questions you have for me? Okay, and I'm going to give the medication to my patient. Here's some water, and then here's your cough syrup. And I'm going to take my gloves off, wash my hands, and I'm going to document all the medication that I've given to my patient.